The effects of aging on the face are unmistakable, and many people choose cosmetic surgery to help alleviate some of the symptoms of growing older. One such procedure we've been hearing a lot about lately is an eye lift, and here to explain that procedure and its benefits, Dr. Robert Langdon is back. Welcome, Dr. Langdon. Thanks for being here.
Thanks, Sonia, for having me.
Well, I think many people, as they get older, complain about the droopy eyelids, especially the bags under their eyes, and maybe think that there's nothing that can be done for this. But there is something. What can be done?
Well, the problem around the eyelids, in the case of the upper eyelid, it seems to be an excess of skin and sometimes also a little bit of fat. In the lower eyelid, the main problem is a bulgy appearance, which is due to fat below the skin. And the technique of eyelid lift is actually called Blepharoplasty, which is actually a 5-syllable word.
Is that essentially a laser using a laser?
There's different ways to do it. Okay. I like to use a laser because it has certain advantages. We're actually incising or cutting through the skin, and the advantage of the laser is that it will seal the blood vessels at the same time, so there's less bruising, less swelling, and a faster recovery. So most people look pretty good in less than a week.
Wow, that's pretty good recovery time. We have some before and after pictures, and the first one is of the upper lid. This is the before picture, and then you did this procedure. And then if we take a look at the after, and tell us, you know, what you did here and what difference it made.
Well, the main thing there is just removing that excess skin, which is causing those folds on the upper eyelid. And after the procedure, you can actually see more of the actual eyelid. So it gives the eye a more open appearance. And the eyelid area is actually very important because when people talk to you, that's really what they're looking at primarily.
It's also a very sensitive area, too. So how much pain is involved? How much pain are we talking about?
Well, of course, the procedure is totally numb. For this, we use anesthesia. And there's actually very little afterwards because it's as surgeries go, it's not, you know, terribly extensive.
And then the next picture we have as well, I think this is, these are the markings that you do in order to know which skin, how much skin to remove, right?
Right. This is an example of an actual patient right before we did the upper eyelid blepharoplasty, and the little dotted line indicates where that incision is actually made. So we measure how much skin there is and take out just the right amount.
What about under the eyes? Because I think a lot of people think the bags are from the alarm clock going off too early. I would know sometimes that I've got them when the alarm goes off at 2 a.m., 2:30 in the morning. Oftentimes, are they genetic, though?
Well, a lot of things are genetic, but the lower eyelid, it always looks worse in the morning, you're right, because when you're lying flat, there's more fluid in the facial area. But it does give this tired, run-down look, and that's what really bothers people. And the solution here is actually just to remove the excess fat.
And how do you do that? The incision goes through the lower lid? You make an incision through the lower lid?
There's different ways to do it. The best way is usually to make an incision actually inside the lower eyelid. So in this case, we're not going through the skin at all. That's actually a safer way to do it. And another advantage of that is that there's no stitches.
I think another way to make you look more awake is a brow lift. That's another option, right?
Right. A brow lift, if someone has a problem with a lower brow position, if you look at this patient here, you can see some very deep crow's feet wrinkles. And that's the area that improves the most with a brow lift. Now, the eyelid actually improves, the upper eyelid, because the eyebrow is attached to the lid, and as the brow goes up, the lid improves.
How common are these procedures? The eyelid lift, the brow lift?
They're actually quite common. The blepharoplasty is one of the most common facial cosmetic surgery procedures. Brow lift, not as common. We also call that a forehead lift. But we're usually helping other problems like even frown lines and horizontal lines across the forehead. All of those get better with the brow lift.
And yeah, with the full facelift or the forehead lift, as you were talking about, I'm sure you get some of the benefits in lifting the eye area as well. But sometimes people just want to go in and target that specific area, right?
Right. Some people, if the upper eyelid problem is not too bad, if they have a brow lift, that may improve it enough that they don't really even need the blepharoplasty. Most people, though, there is enough excess skin that the direct way to remove it with blepharoplasty is the ideal.
And if people have questions, you hold seminars to answer a number of these questions.
Correct. We have seminars every month, typically in our office. And you can go to our website to find out more information about when that is held. It's right in our office, usually on a Thursday.
Usually on Thursdays. We do want to mention again, Dr. Langdon's book is called Understanding Cosmetic Laser Surgery. And as you were mentioning, we'll put your information up on the screen. That's where you can reach Dr. Robert Langdon, or you can always just come to our website, WTNH.com, and click on the Connecticut Style link, and we'll get you there. Dr. Langdon, thanks for coming in. It's good to see you again. Appreciate it.
Okay, thank you, Sonia.
And don't